All right, we're just scanning the room here, so Kendall can come in and do her assessment. Oh, looks like she's here.
Hi, my name's Kendall. I'll be your student nurse from the University of Detroit Mercy. Just going to close the door for privacy and wash my hands first before we begin our assessment. So we'll wash my hands. Can I have your first and last name as well as your date of birth, please?
Yes, Kara Mazer, 4489.
Okay, and do you know the date today?
Yes, October 2nd, 2013.
Do you know where you are and why you're here?
Yes, UD for physical.
Okay, patient is alert and oriented ×4 to person, place, time, and situation. General appearance, patient appears stated age, no signs of distress, no obvious signs of illness, no body odors that are apparent, no odors coming off the breath. Patient is dressed appropriately for the season. Patient, are you experiencing any pain today that we should be aware of?
No.
And do you have any allergies that we need to be aware of?
No.
Okay. I'm going to begin by looking at the scalp and the hair, feeling for the texture for any malnourishment. Hair is not brittle or breaking, hair is soft and moist. Looking at the scalp for any balding patches of alopecia, any head lice or parasites, none of which is noted. Overall head is symmetric, normocephalic, palpating for any masses or bumps or any misshape, any bulging which are not apparent. Moving on to the face here, nose is midline where it should be placed. Looking at the eyes, first we're going to look at the conjunctiva for any inflammation, which they are pink, moist, and no signs of swelling or infection there. I'm going to look at the pupils, which I can see right now are equal, round, and I'm going to test their reactivity to light as well as accommodation. So just keep looking straight ahead, and I'm noticing that the pupils constrict upon the, with looking at the light. And now if you could follow my pen with your eyes, appropriate accommodation noted. Now I'm going to assess cranial nerve 5 for sensation on the face. So just close your eyes. And are you feeling my hand placement on all parts of your face here?
Yes.
Okay, cranial nerve 5 is appropriate. Now looking at cranial nerve 7, we're going to test equal symmetrical movements of the face to note cranial nerve 7. So if you could squint your eyes for me, puff out your cheeks, and smile with your teeth. Okay, cranial nerve 7 is working. Looking at the ears, now I'm just going to palpate for any. Is there any tenderness here? No obvious buildup of cerumen or foreign objects noted, no swelling. I'm going to test cranial nerve 8 for hearing really quick, so I'm going to block this ear and I'm going to whisper something, and if you could just tell me what I said.
School. Exams.
Okay, hearing is appropriate. Now I'm going to look at the mouth. No cyanosis of the lips. Lips are pink and good blood flow to the lips. No oral lesions noted on the outside. I'm just going to have you open your mouth, stick out your tongue. Say ah, please. Okay? Alright, that's great. The tonsils are 1+ bilaterally. The uvula is midline and it moves properly upon saying ah. And there's no, the tongue, buccal mucosa and soft palate are all moist and pink. There's no plaques or lesions on the tongue. Teeth are all present. No dentures or fake teeth. Gums are not bleeding, and yeah, that's about it for the mouth. Okay, we're moving on to the neck now. First I'm going to palpate the lymph nodes, and just let me know if any of this is tender. So we're going to look at all sets of lymph nodes, so pre-auricular, post-auricular, occipital, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Actually, I'd be more right here. Any pain upon palpation there? Also, we're going to look at the submental, submandibular, jugulo-digastric. Any pain there? No swelling of the lymph nodes either. Can I have you look to your left, look to your right? I might be saying the wrong, I'm sorry. And look up, look down. Range of motion of the neck is appropriate, and now I'm just going to auscultate and palpate the carotids one at a time. carotid pulse is present, 2 plus. Same thing on this side, equal rhythm and rate. Now I'm going to listen with the bell of the stethoscope to listen for any bruits. No bruits or whooshing sounds heard there. Now I'm going to look at the skin of the arms here. So I'm going to palpate with the back of my hand to test for temperature. Temperature is warm and appropriate. No, I'm going to palpate for any lesions, masses. Moisture is, it's not, no sweating or clamminess, no suspicious moles. And they are equal in size. And I'm going to palpate the radial pulse. Bilateral, they are equal, 2 plus, as well as the brachial. Bilaterally, they are also equal pulses. Looking at the nails for any breaking, brittleness, nails appear to be healthy. Proper capillary refill in 2 to 3 seconds. No clubbing of the nails either. Can you grab my fingers as hard as you can? Okay, good strength on both sides. And skin color is appropriate for ethnicity, no inflammation. And proper hair distribution. So now I'm going to move on to the back here to listen for lung sounds. I'm going to do it in 10 different places, so every time that I move my stethoscope, can you take a deep breath in and out of your mouth? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Also listening laterally. No adventitious sounds noted on the posterior side of the lungs. We're also going to listen to the lungs anteriorly in 10 different places. Starting at the apex of the lungs, we're still going to do 10 different spots. Okay, no wheezing, no adventitious sounds noted there as well. We're going to go right into the heart sounds now, starting at the aortic location, moving on to the pulmonic, where S2 would be heard loudest. Then we have Erb's point, tricuspid, and mitral. And here we're going to listen to the apical pulse for about 60 seconds. And after that, we're going to flip it over to the bell, listen again for 60 seconds to listen to the apical pulse and move back up. Tricuspid, Erb's point, pulmonic, aortic. Also would like to note that you can hear S1 loudest at the apical point. And the heart rate is good rhythm and rate, and no evidence of any murmurs. I would also like to note at this point that the patient's mood and affect are congruent, and the patient appears calm, no slurred speech, and her posture is comfortable and straight. Okay, now that I've listened to the heart sound, I'm going to move on to the abdomen. So can I have you lay back? First, just noting the general appearance of the abdomen. It's non-distended, and it's flat, and it's symmetric. There are no signs of obvious bruising or swelling masses, and no scars that would indicate a previous surgery had been performed. First, I will auscultate because I don't want to disrupt the vowel sounds and make any false vowel sounds. Starting in the right lower quadrant, I'm going to listen for no more than 5 seconds. 5 minutes. Right upper quadrant, left upper quadrant, left lower quadrant. Vowel sounds were heard in all 4 quadrants. I'm going to palpate lightly in each quadrant and name the major organs that can be found. We have also noting if there's any pain or any grimacing with the patient that would indicate any pain. We have the appendix down here, the borderline of the liver up here, spleen and stomach, and the sigmoid colon down here. Any pain when I'm palpating there?
Nope.
I'd also like to percuss, looking for any tympanic sounds, which most of the abdomen should be tympanic. Maybe slightly dull over the borderline of the liver or over any stool. Okay, and I'm going to have you sit up. I'm going to assess the AP diameter, which is 2 to 1. No signs of barrel chesting indicating COPD. And I'm also going to test the kidneys for any tenderness. Any tenderness there? No. What about there? No. No? Okay. I'm sorry, I'm going to have you lay back down. I apologize, I should have assessed your legs while we were down there. So we're assessing the lower extremities for temperature, which is warm. Good signs of circulation here. No pitting edema as I press into the tibia, as well as the malleolus. Temperature is appropriate. I'm going to feel for the pulses on the dorsalis pedis at the top of the foot here, which are equal to plus, as well as the posterior tibial bilaterally 2 plus. I'm going to also look at the capillary refill on the toenails by pressing on them and checking that the color returns within 2 to 3 seconds, any signs of clubbing, brittleness of nails down here as well. And I'm also going to do the Babinski test where I run my finger up the bottom of the foot to see if the toes curl in an appropriate response. And okay, so I'm now going to have you sit up and stand up. Okay, can I have you close your eyes and just keep your arms at your side? We're going to do the Romberg test and test for balance, and I'll be here in case you lose your balance. We would do this for 30 seconds, and you can open your eyes. Patient's balance is appropriate. I'm going to have you walk to the end of the room here and back, looking at the gait. Gait is appropriate. And can I have you bend over and touch your toes? Looking at this spine, the curvature of the spine is straight, no scoliosis. Okay, you can stand back up. And do you have any other concerns that you would like me to know about? No. No? Okay. That completes our assessment. I will wash my hands and go well.